Thank you. And good afternoon. There's a bet in Miami, and over under of all my colleagues wondering, I lost the bet, wondering how long it would take me to get emotional here. And they all bet 90 seconds and they lost. Thank you, Dr. Flenner, President Abu Hamad, for this very undeserved introduction and this invitation. Guys, first important take-home point, okay? As residents and attendings, remember to be very nice to your junior residents, interns, and medical students, because you never know who's going to become president of your medical school one day. You know, if I hadn't been that nice to them, I can assure you I wouldn't have been here. So let me congratulate you on the amazing feat that you've accomplished. As Dr. Muhammad said, you know, it's an amazing feat. It takes a village. Your family got you here. As medical school faculty, I want to preemptively thank the people who are going to get you through this. These folks right here, okay? This is no doubt well-deserved. If my story, which really isn't a speech, has a title, it should be The Gift. And there's no doubt that you being here is very well-deserved, you guys. I know that. You wrestled with organic, biochemistry, trying to make sense of magnetism and electricity and physics too, right? Spoiler alert, you're not gonna use it again. Okay. You know, to get where you are, you practically had to discover a new element in the periodic table, right? You had to go to the four corners of the world to do research, deworming orphans, all the while trying to stay healthy enough to take that quiz that we all had to, what was that called? An MCAT, right? You know, and despite all that, you made it. But make no mistake, your being here is a beautiful gift that you were given. Not only was it a gift to be admitted to medical school, this is not going to be recorded and make its way to South Florida, right? Okay. Not only did you make it into medical school, but you made it into the best medical school in the country, right? Come on, really? I know, because I was there. We share this gift. We share this gift. So today, I want to share with you via story when I realized the significance of this gift and how it changed the purpose of my life. So, unlike you, I was not a stellar student, not even close, okay? But despite below average grades and a semi-decent MCAT maybe, this new medical school in Norfolk granted me an interview. I came, I was waitlisted, I was deferred, and walking away, they called me and said, would you consider applying next year, early decision? I said, of course. I loved my interview there. I didn't share it was my only interview, but I said I loved it, right? So I applied, and early decision, September 30th, 1978, my gift arrived in the form of an acceptance letter. We got letters, you get emails. I'm sorry, letters are far more dramatic, okay? But I was 21 years old. I was too young and ignorant to really recognize what the gift was. But soon I realized that those 3 years were pivotal in my life. And I began to see that the gift was not merely about being accepted to medical school, but was about immersing myself with 93 other amazing individuals. Where we were dumped into the world of medicine. We were led by a dean who was simply referred to as Pooh. We had faculty who actually thought of us as younger peers, and we made this all possible because we carried each other. And this is part of the mentality that I want you to share, because what we had was a no one left behind mentality. And that's what I want you to embrace. And I want you to stop for a minute and just look around to your peers. Take a second and really look around at these people. These are going to be your brothers and sisters for life. Look at your faculty, okay? Yeah, even my friend here at the end, right? Even my friend at the end. These are all part of your gift. They are all part of the gift that you have been given. So, 3 years in Shangri-La, 7 years in the abyss, okay? I did my residency at the University of Miami Jackson Memorial Hospital in the 80s. I am going to leave it to President Abu Hamad at some point to share memories of what medicine in the 80s in Miami, cocaine cowboys, etc., was all about. Do not share the stories from last night. Okay. Okay. So fast forward a few years, and this is where the story starts. If the music cues up, I'll shut up. I'm imagining this is somewhat like the Oscars, that when my time runs out, the music is going to start. But anyway, a good friend of mine who was a resident at Jackson had gone to work as a medical missionary in a remote village of the northern part of the Dominican Republic. We couldn't have audio-visual, so I sent you guys PowerPoints on purpose, because I really think that a picture's worth 1,000 words, and I'd be talking all night, so I sent them to you so you can scroll through and get an idea of what this was all about. He'd been there for a while, and he was seeing all sorts of patients, and he realized that a lot of what he was seeing were surgical conditions, and that he needed a group of surgeons. So he came back to Miami, got a bunch of us, and convinced us to go down. He got 2 general surgeons, a couple of medicine residents, myself, some volunteers. We raided an OR's staff. We took nurse anesthetists, scrub techs, everybody, and we came back to the Dominican Republic. Now, at the end of the town was an abandoned hospital, which you'll see in one of the pictures, a very young Dr. De Leon standing in front of it. It was an abandoned hospital. There were beds, but no mattresses, sparse electricity, contaminated water, no medical equipment. So we brought everything. We set up a clinic and started seeing and triaging patients. Our plan was to do the most acute cases first until we ran out of anesthesia, IV fluid, gases, everything. So we'd begin surgery like at 7 a.m. in 2 operating rooms, one for major cases, one for minor cases, and we'd work well into the night, sleep for a few hours, and then begin again. The cases we saw, guys, were beyond the description that I can share with you. And they were far beyond what we felt our surgical skills and knowledge were. They were far beyond what we possessed at the time, yet we were able to do it. Ostomy breakdowns, I dealt with obstetrical, rectal, and vaginal fistulas. We even saw a 9-year-old boy whose arm was melted onto his chest from a gas fire, and we're able to create flaps and release it. I even delivered a set of undiagnosed twins. Amazingly, in the middle of nowhere, No, everything progressed uneventfully. No transfusions, thank goodness, because we had no blood, right? No post-op complications, not even infections. Everything ran incredibly well. I don't remember how many cases we did. What I do remember is that despite my 7 years at one of the largest hospitals at the time in the United States, and the experiences that we shared there during that time, I felt like I had become twice the surgeon that I ever was. So, on the last day of our mission, we were done. Everything was packed up. We had a bus to take us on a 4-hour ride to the airport, or 4 or 5-hour ride. And right before we left, Dr. Moaz, my friend, myself, and my wife, Debbie, in the front seat with the yellow dress, were making last-minute rounds on the 20 or so patients who remained. When a woman walked in with one of the missionary nuns with a real skinny, scrawny 8-year-old kid. Well, this kid's peritonitis shuffle and the fact that he was holding his right lower quadrant meant he had what? Aren't they in medical school? What? Appendicitis, thank you. Excellent, excellent. So, the bus was full of people, right? So we took the boy, my wife, Dr. Moaz and I, we laid him on the table. He was so skinny and had an anterior lying appendix, you could feel through the skin and almost feel it, okay? So at that point, we say to the mother, listen, this is what he has. We're happy to take him with us. We can take him to a hospital near the airport where he can have an appendectomy. Amazingly, she just picked up the boy, started walking away with him, and she was going to give him some home remedies and just take him home. So my wife asked, she says to the nun, well, what's going to happen? And the nun said, well, we see this every once in a while where kids show up and they have really bad stomach aches. They get really, really hot, and then they die. And it was part of life. When my wife heard this, remembering our twin boys in Miami, she says, not today. This isn't happening today. Not on my watch, this isn't happening. And she tells to Carlos and I, you have to take out his appendix. Now, the bus had already left, right? We're there, we're stranded. It's this friend of mine who's a pulmonologist, myself and my wife, and we're figuring out, we had no oxygen, we had no nitrous, we had a little bit of meds that we had left over, and that was it. So Dr. Moaz said, I found a pediatric endotracheal tube. I think I can intubate him, we can paralyze him, and maybe you can do the surgery. And I'm like, remember, I'm a gynecologist. This is a male 9-year-old, right? The last time I saw this was 3rd year EVMS Portsmouth Naval Hospital, right? So it really came down to if we didn't operate, the boy would die. If we operated, he might die because we really did not have the equipment. So it was just the 3 of us and a couple of the nurses who were there. So we carried the boy to the operating room. We were in street clothes with just surgical gloves on. We took a deep breath and started. And Dr. Moaz successfully intubated the kid. We paralyzed him, ventilating him with an ambu bag with room air, right? Still 20% oxygen, but room air, right? And he paralyzed him and started ventilating him. He gave him a little bit of succinylcholine. We paralyzed the boy. And I'm there I'm flashing back to third year EVMS, remembering McBurney's point, right? And I'm like, I think it was, I had done appendectomies, but on women in the course of doing a hysterectomy. So I'm trying to remember where this is. And I followed the procedure to the best of my memory. I cut the skin, I cut the fascia, separated the muscle, picked up the peritoneum, cut it, and just like that, guys, out popped the appendix, right into my incision. I picked it up, clamped it twice, stitched the first stump, buried the second one, right? Closed the layers. I think the whole procedure maybe took 7 minutes. So I'm there holding the appendix, and I look at the head of the table, and I'm like, Carlos, I'm done. He goes, you're done? He goes, yeah, I'm done. Here's the appendix. I'm done. He goes, are you sure? Yeah, it's done. It's closed. There's nothing else to do. So he reversed the paralysis, right? Extubated the boy, reversed the paralysis, and we pretty much were holding our breath, waiting for him to breathe. Well, he started to cough almost immediately, and we were like, okay, when he breathed, we breathed. And we immediately moved him to the post-op area, and with no time to celebrate, because remember, an hour and a half had passed, the bus had left, we had to catch him. We're like, we need a ride to catch this bus. So what shows up to take us there is a little tiny Fiat. Think of a clown car from the circus, right? Now, one of the perks of being an XXL type, right, is that you always get shotgun, right? Oh, you go in the front. It's okay. Rollo, you can go in the front. So I get in the front seat, and we leave. And we leave dirt roads all the way. And about 15 minutes into the ride, I start crying uncontrollably, but sobbing uncontrollably. My wife is behind me. She's rubbing my shoulders, and she's saying, it's okay, Rollo, it's okay. You got the appendix. He's okay. He's gonna live. And the more she would comfort me, the more I would go, no, that's not it. And she would say, he's okay. No, that's not it. I was not crying in cathartic relief for what we had just experienced. It was way deeper than that. All of a sudden, I flashed back to September 30th, 1978, when I received my undeserved letter of acceptance to EVMS. And at that moment, in that clown car, on that dirt road, I had my epiphany of what my gift had truly been all about. I was overcome with the realization that I had to have been accepted to medical school. Study, finish, become a physician, complete a residency that provided me the surgical knowledge and training to be able to be there that day to save that boy's life. Everything had come full circle. The endless studying, the clinical rotations, the long nights on call had all led me back to that moment. I realized that the gift that this amazing institution had given to me needed to be put to the service of others for the rest of my life. I've never refused the care of a patient. For 30 years, I have dragged this poor woman to desolate places to accompany me to do mission work for the people. And 90% of that work wasn't really to change the course of healthcare wherever we were going. It was a drop in the bucket. It was really to remind the people in those villages that the world had not forgotten them. We still remembered they were there, and we were there to be, for whatever little bit of time we could, for them. Guys, I'm 66 years old. I'm about to retire from clinical practice, like Dr. Flunner said, to spend the rest of my time mentoring and teaching your generation of physicians. My wife says it's a very easy job, okay? She makes it, she says, Rollo, your job is really easy. And I'm like, really? Let me talk to you about neuroembryology, right? And she said, no, your job is really easy. All you have to do is make them fall in love with medicine. Like you have, and it's going to take care of itself. And it's going to take care of itself. So you have been given this very gift, guys. This is your gift. We share this gift. It's ours. We're here. This is our gift. So as you put your white coats on today and you begin to assume the superhero identity that lives inside of each and every one of you. Right? Remember, this white coat is an external sign of the gift that you have been given. It represents healing and hope. Just as sure as we're sitting here today, I'm telling you that right now, there are thousands upon thousands of people who don't even know you. They don't know you, but they are patiently waiting for you to finish medical school, become physicians, complete residencies, so that you can be the healers and lifesavers for them and their family. It's for them who we study. It's for them who we stay up late at night and wake up early and sacrifice weekends and everything that we're going to sacrifice. It's for them that we're going to learn to develop and sharpen our diagnostic and surgical skills. The cool part about this is we don't have to go to the ends of the world to find them. Because you know what? They're going to find us. They're going to find us. And they'll find you. You know why? Because those white coats are magnets that are going to call to them. They are magnet for those in pain, for those who are suffering, for those who need healing. All we have to do is recognize them and have the courage to say yes. Guys, share this gift. Share this gift every day of your professional lives, okay? Being with you here today at our EVMS has really been the greatest honor of my professional life. Thank you.